coming to you today from our YouTube channel talking about how to put on a gait belt properly. CNAs use gait belts, therapy uses gait belts. We want to make sure that you know how to put them on properly if you're taking care of a family member. First thing to know, teeth first. So you always want to bring your gait belt, wrap it around. You always want to have the teeth first. So this is going to go through the teeth area and then wrapped around through the other slot and pulled in tight. If you need to adjust it, you just pull the gait belt here in from the teeth and then pull it tight around here. A couple things you need to be aware of. Make sure that you have material or cloth between the patient's skin and the gait belt. It will chafe, it will hurt. Also, you need to be aware that if the patient has any kind of apparatus or ostomies, tubing, drain tubes, things coming out of their stomach, you need to be aware of that and to either go above it or below it, and just be constantly aware as you're using this gait belt so that you're not hurting the patient. Another thing is, if you are the therapist or the caregiver, when you have a patient that you're walking with, use your hand from underneath so that if they were to fall, you have the ability to stand them up. So you're coming up against the gravity. A couple things: when you sit down, when you put on a gait belt, patients will normally be in a sitting position. That way you can assist them to stand. So you want to be aware, again, if they have any apparatus, any kind of tubing coming out, you've got to be aware of where that is. Just to also clarify, have it snug enough where it's not going to come up and down, because if you have it loose and you're trying to stand a patient up, it will come up, it will scratch their skin, their sides, and you also want to be careful with the breast tissue. Thank you for watching our video on how to put on a gait belt properly. I hope that was helpful. Please subscribe to our channel, and we will be talking about transfers in our next video. Thank you.